So this is the foramen ovale. Through this foramen ovale passes this male हो गया, this mandibular nerve, accessory meningeal artery, lesser petrosal emissary vein which connected the pterygoid plexus of veins to the cavernous sinus, and through this foramen spinosum this passes the man is the meningeal branch of the middle meningeal artery. The man is the middle meningeal artery, emissary veins which connect the pterygoid plexus to the cavernous sinus, and nervus spinosum which is a meningeal branch of the mandibular nerve only. This carotid canal passes this internal carotid artery which transverses through it and the plexus, sympathetic plexus around it, and through this foramen lacerum no structures passes it, only the structure transverses through these structures. And in this foramen lacerum the greater superficial petrosal nerve and the lesser petrosal nerve and the deep petrosal greater superficial petrosal and the deep petrosal nerve combine together to form the nerve of the pterygoid canal, and this nerve pterygoid canal passes through this foramen of the pterygoid canal anteriorly, which passes in the anterior wall of the foramen lacerum, and through this foramen magnum divided into the wide posterior parts. These wide posterior parts provide attachment to the medulla oblongata and all the meninges around it, and through the medial part passes the anterior vertebral artery, anterior spinal artery, posterior spinal artery. Vertebral artery is venous plexus around it, and the spinal part of the accessory nerve. So this is medulla oblongata and the meninges around it, anterior spinal artery, posterior spinal artery, and vertebral artery with venous plexus around it, so sympathetic plexus around it, and the spinal part of the accessory, while the anterior part provides attachment to the AVM, apical ligament of the dens, vertical, then the apical ligament of the dens, vertical band of the cruciate ligament, and membrana tectoria. Then the apical ligament, then the AVM is the apical ligament of dens, vertical band of the cruciate ligament, and membrana tectoria. So from this hypoglossal canals, then the hypoglossal anterior condylar canal transmits the hypoglossal nerve and the meningeal branch of the hypoglossal nerve, and the meningeal branch of the ascending pharyngeal artery and emissary vein which connect the sigmoid sinus and the internal jugular veins. This is the posterior condylar canal transmits emissary vein which connect the sigmoid sinus with the suboccipital venous plexus. Then from this jugular foramen, through this jugular foramen, from anterior to posterior, the IPS map 9, 10, 11, an internal jugular vein is coming out. So through this trick, the IPS is the inferior petrosal sinus, and the meningeal branch of the occipital artery is the inferior petrosal sinus, and the meningeal branch of the occipital artery, ascending pharyngeal artery, IPS map. So IPS map is the inferior petrosal sinus and the meningeal branch of the ascending pharyngeal artery, 9th, 10th and 11th cranial nerves. The spinal part passes through it, cranial part passes through it, and the internal jugular vein and the meningeal branch of the occipital artery in the most posterior part. So there is the mastoid canaliculus in the lateral wall, through which tympanomastoid suture is present, passes the auricular branch of the vagus nerve.